Hello, I'm Mallory Butler, Chief Executive Officer at Family Safety Victoria. In the spirit of reconciliation, I acknowledge the traditional owners and custodians of the country throughout Australia and their connections to land, sea and community. I pay my respects to their elders, past and present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples listening today. I'd like to extend a very warm welcome and thank you for viewing this video on family violence response during COVID-19. As you know, the Family Violence Multi-Agency Risk Assessment and Management Framework, known as MARAM, was developed by Family Safety Victoria in response to Recommendation 1 from the Victorian Royal Commission into Family Violence. In its essence, for all of us, MARAM creates a consistent response to family violence risk across all services that may come into contact with people experiencing violence and abuse. It provides us with a framework for a consistent approach to family violence response and ensures we are working together to make a real difference in people's lives in our communities. Service providers have embraced MARAM, and I'd like to acknowledge your unwavering commitment to keeping victim survivors safe and holding perpetrators in view and to account. The coronavirus pandemic has been unprecedented in our community, and along with the health concerns this pandemic brings, we've also seen an increasing awareness of the heightened risk of family violence during the COVID-19 pandemic. Our responses during this time are vital to reducing family violence-related harm and homicide. This video outlines the MARAM risk factors in the context of COVID-19. It outlines the emerging evidence of increasing family violence. It discusses best practice responses during COVID-19 for specialist practitioners, with reference in particular to newly developed MARAM guidance notes and practice notes. And it explores the importance of collaborative practice to keep victim survivors safe and perpetrators in view and accountable for their actions. I hope that you find this video useful for you in your practice, and thank you very much for working with us at Family Safety Victoria to achieve our shared goal of preventing and ending family violence for good.
Since March, there have been restrictions in place across Victoria to protect against the spread of coronavirus. As a result of the restrictions, many services and organisations have worked hard and responsively, transitioning to working remotely and using different forms of online service delivery. They've also had to limit face-to-face contact with clients and service users, affecting schools, childcare centres, playgroups, health, counselling and courts, to name a few. Evidence shows that family violence risk increases during a crisis like the one we're experiencing at the moment. There is also evidence that perpetrators of family violence may change or escalate the frequency or severity of their use of violence and controlling behaviours. Identification of family violence and the level of risk is assessed by understanding the prevalence of known evidence-based risk factors, which we will now outline, adapting to the context of this pandemic.
Evidence-based risk factors are those factors which are associated with a greater likelihood and/or severity of family violence. Some of the risk factors indicate an increased risk of the victim being killed or almost killed. These are highlighted on the slide shown on your screen in bold and with a red star. For the majority of Victorians, COVID-19 related quarantine, physical distancing and travel restrictions have created or increased isolation. Mental illness and depression may also increase as a result of isolation, as well as anxiety around the pandemic itself. There are many reports that drug and alcohol use are increasing significantly during this time, which in some cases may be described as misuse. This may be coupled with other changes in circumstances, such as if the perpetrator is unemployed or disengaged from education, a known high risk factor. Where these factors are present for perpetrators, they indicate an increased level of risk of perpetration. When they are present for victim survivors, it indicates a need to review the risk assessment and management plan, particularly around those identified needs. There are specific risks to children. The intensity of being confined to home in uncertain and stressful times, without access to usual sources of help and respite, heighten the exposure to family violence for children. Increased threats or demands related to parenting and child access are occurring due to social distancing requirements. At any time during a crisis, the risk of suicide is higher for perpetrators and victim survivors. This includes both adults and young people. If perpetrators are using threats to suicide or self-harm, the victim survivor should be considered at serious risk and requiring immediate protection, as there is an increased risk of being killed or seriously injured. COVID-19 presents an opportunity for perpetrators to exert additional or new controlling behaviours over victim survivors in ways perhaps previously limited to them. This is another high risk factor. The evidence-based risk factors are a core component of the structured professional judgment model. Asking about and identifying which evidence-based risk factors are present will directly inform an assessment of the level of risk.
Over the past few weeks, there has been increasing awareness of these heightened risk factors. Evidence, including from countries such as China, has shown a 50% increase in family violence reports during COVID-19. International data suggests that an increase in family violence reporting occurs once COVID-19 restrictions are lifted. Other services have identified an increase in family violence indicators and direct disclosure of violence from victim survivors and perpetrators. Our responses during this time are vital in reducing family violence-related harm and homicides. Specialist services have taken steps to support victim survivors to seek help during the COVID-19 restrictions. Family Safety Victoria is undertaking targeted work to assist with addressing family violence risk during the COVID-19 period, including through the development of new MARAM Practice Notes. The video will now take you through the practice notes for specialists working with victim survivors and for working with perpetrators.
The Victim Survivor Practice Note provides 3 minimum steps to take. 1. Review risk assessments for existing service users as soon as possible, utilising guidance within the practice note. 2. Update all existing risk management and safety plans. 3. Plan ahead for appropriate methods of communication during physical isolation and social distancing. Risk is dynamic, and any change in circumstances for the victim survivor or the perpetrator can impact upon the level of risk. It is important that all current and new clients should have a revised risk assessment and updated safety plans in response to COVID-19 related quarantine, physical distancing and travel restrictions. The practice note contains an adapted MARAM risk assessment template and questions which specifically ask about changes or increased instances of controlling behaviours as a result of COVID-19 and any threats to self-harm or suicide. A perpetrator threatening suicide or self-harm means the victim is at increased risk of being killed or seriously injured by that perpetrator. Existing safety plans will need to be updated to take into account changed delivery of many services, increased time spent at home, and a lack of contact with third parties. A COVID-19 safety plan template has been provided within the practice note. The safety plan includes questions around variation to intervention and court orders, which may need updating if a perpetrator has returned home, is excluded from the home, or if there are changed parenting orders and arrangements. The safety plan explores methods of communication available during isolation and updating where there is technology abuse or stalking. It also explores the support that may be offered by trusted third parties and services during this time, such as a GP or pharmacist or someone close by who can call the police. Finally, the safety plan also includes a section on managing increased emotional abuse and any indicators of suicide ideation, including a suicide and self-harm first aid and safety plan. The practice note highlights important considerations around communications at a time when the perpetrator may escalate their use of technology to monitor and control communications. It outlines the importance of strengthened responses to secondary consultation and coordinated practice with non-specialist services. This includes where direct engagement with a victim survivor is not possible due to their choice, circumstance, risk or fear, such as monitoring and controlling behaviours from a perpetrator. The practice note for specialists working with perpetrators includes minimum steps to take. 1. Review assessment of risk. 2. Update safety plans and risk management approaches. 3. Work collaboratively to keep the perpetrator in view and the victim survivor safe. It is recommended that all specialist family violence practitioners in perpetrator intervention services read both victim survivor and perpetrator-focused practice notes as a minimum and use the suggested approaches in practice. The note outlines the standards of practice for assessment and monitoring based on the level of risk and the needs and circumstances of the perpetrator. It identifies appropriate interventions to reduce risk, enhance safety, maintain engagement, and encourage behaviour change. This includes guidance from the Magistrates Court of Victoria for court-mandated clients. Risk assessment through direct questions to the perpetrator to help determine level of risk have been added. As you can see, these include questions around changed circumstances, concerns about their use of violence and triggers, court and intervention orders related to parenting and violence, and other risk management interventions. Direct assessment of suicide risk and managing emotions is provided. Perpetrators who have threatened suicide or self-harm should be given support through suicide first aid and safety planning. As mentioned earlier, victim survivors should be considered at serious risk and requiring immediate protection if threats to suicide or self-harm have occurred. The practice note also outlines practical violence prevention planning, discussing risk and needs, including accommodation, parenting, financial security, escalation or change in use of alcohol or drugs, mental health and legal issues, including court and intervention orders. The note promotes proactive information sharing with victim survivor specialist services if risk escalates and to activate risk management interventions.
We've heard from other services that they are identifying more indicators of family violence risk, increased severity of violence, and hearing more direct disclosures compared to pre-COVID-19. This likely reflects the reality that victim survivors are not only experiencing an increased level of risk, but are also experiencing limited opportunities to engage help, alongside increased monitoring and controlling behaviours. Family violence specialist services and practitioners are actively considering now how they will meet the expected increase in demand for secondary consultations and ongoing coordinated risk assessment and collaborative practice under the MARAM responsibilities. Here at Family Safety Victoria, we are working on further practice notes targeting identified services and cohorts at increased risk, including, very importantly, children. We will welcome your advice and thoughts about other areas we could focus on, because these notes need to be relevant for you. Many thanks for your time in watching this video. We'd really appreciate your feedback and advice on this form of communication and whether it works, so please get in contact with us. Thank you again for all your hard work during this time.